Welcome everyone to today's webinar, In Ways COVID Will Transform the Revenue Cycle, Accelerating Long-Time Healthcare Industry Objectives for the Good, sponsored by RevSpring. I am Ayla Ellison with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We look forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. It's now my pleasure to introduce today's presenter. Kristen Jacobson is the VP of Marketing and Omnichannel Products at RevSpring. She is responsible for product management, product marketing, corporate marketing, and brand development at RevSpring. Kristen came to RevSpring through the acquisition of Apex. She brings a unique perspective to healthcare financial communications, having spent 25 years in a wide variety of marketing and product management roles with leading customer experience technology organizations. At this time, I am pleased to turn the floor over to Kristen to begin today's presentation.
Thank you, Ayla. And first of all, I just want to thank Becker's for hosting this forum and others like it. It's really a great way for us to digitally stay connected with providers like you, and we're pleased for the opportunity. We also just want to always take the time to thank healthcare providers and organizations on the front lines amidst this pandemic. COVID has been particularly challenging in the healthcare industry for obvious reasons. And certainly there's not a lot to celebrate around COVID-19, particularly in healthcare. So I just want to make sure I'm clear that with this session, it's not at all our intent to trivialize what's happening by any means, but we do see some silver linings. We've been spending a lot of time talking to clients, analysts, and conducting sessions like this in general with thought leaders in healthcare technology and revenue cycle. And we're seeing some interesting trends, and I guess I would characterize them as waves of change in the healthcare market, which is what we want to share with you today. So as we go to the next slide, and maybe just give you a little bit of perspective first on those of you who may not know RevSpring, just to give you maybe a little bit of perspective on our observations. We're a patient engagement company primarily focused in revenue cycle. We deliver 1.5 billion communications in every channel, both pre and post-service, on behalf of our healthcare clients. So we cover a lot of healthcare and likely work with some of you today. So thank you for joining, and thank you for those of you on the call who we don't know. It really strikes us that there's a lot that's happening as a result of COVID that's having some positive impact on key initiatives that have been, from where we sit on the books for revenue cycle optimization at many organizations for a number of years. But they've been a challenge to prioritize for a variety of reasons. So what's really clear to us is that COVID is really driving smart change, and it's going to be critical in order to kind of weather the pandemic. So we've made some predictions at RevSpring based on what we're seeing and hearing from providers and analysts and others like you. And we thought it would be fun to break from the regular webinar format for today and do more of a little bit of interactive polling to see how all of you are coping with the changes in healthcare, what changes you're experiencing and seeing in your own organizations. And then we'll take a look at how that matches up with what some of our predictions are. So we'll see what we got right and where maybe we missed the mark, but ultimately it's really our goal that you take away either a new idea, maybe a positive reinforcement of a change that you're already making, or perhaps inspire some thinking around an approach that you hadn't considered. So let's dive in with the first polling question. So I'll let you go ahead and get started while I kind of talk you through the question. So the first question is, which existing technology did you use in a new way since COVID-19? So go ahead and select all from this list that apply to your situation. So did you make changes to your website? Did you use appointment reminders in a new way? Have you considered the use of broadcast messaging in new and different ways? Maybe you've thought about new ways to make the most of your EMR platform technology. Maybe it's billing statement changes, even your payment portals, the IVR platform, if that's something that you're using, email and text communications, or anything else that you may have used in different ways as in response to COVID-19. I'll let those responses come through. So not surprisingly, email and text communications used in new ways, primary. I'm interested to hear what the other is. It's always fun to see that other bucket populated. The website, certainly something that we've seen quite a bit of. So I'll have you go to the next slide, Ayla. You know, what we've seen is consistent, and I guess what I would say about the responses is there's consistency in terms of literally every one of those technologies that you have today. Somebody in the audience today has used those technologies in new and innovative ways. When we've polled healthcare leaders, we've seen that 69% feel that they had technology they needed to connect with patients when the crisis first hit. So, and that's really about, you know, from our standpoint, about innovation. One trend that we see quickly emerging is maximizing the value from products that you already have in use today, which we've seen from the poll. We've seen from in our customer base, providers use broadcast messaging technology that previously had been used primarily for, you know, appointment reminders and marketing messages being used to get the word out around COVID. Certainly, we've seen corporate websites, statements, even payment portals being used as a messaging platform to notify patients about changes in how you're providing care. And, you know, certainly using those core technologies to provide direct links to telemedicine and making sure that patients were aware of those types of technologies. So I think, you know, what we're seeing is that as providers, you're going to start to look at your communications platforms and think of them as more general communications platforms that are not single purpose but multi-purpose. It's really more of a do more with less strategy, and it's encouraging to see the innovative ways that healthcare organizations have used those technologies in creative ways. So our prediction is that every channel and touch point to consolidate messages and communicate more efficiently is a practice that we'll continue to see. So we'll go ahead and go to the next polling question. So this one's really more about kind of to that point of how do you use what you have in new and innovative ways. What are the things that you're doing today that you wish that you could do less of? So, you know, where do you see opportunities to maybe streamline your processes today? Is it sending out patient statements, sending multiple reminders, maybe for the same request, using multiple products and platforms that do similar things? You may have seen that as you look to your messaging platforms to get the word out. Obviously, you're able to use multiple platforms to kind of do the same thing. Manually calling patients, handling inbound calls, or processing checks. So we'll let those responses come in. So multiple products and platforms that do similar things. So we've got a great slide following in the presentation that'll support what we're seeing as well. Handling inbound calls, we certainly see a lot of providers trying to do more with automation. So deflecting inbound calls and using IVR and other technologies to be able to handle those simplified calls so that the agents can really focus in on those calls that require more direct human-to-human assistance. And then it looks like the third is sending patient statements. So if we go on and look at the next prediction, It's really about, one of the predictions we have is that providers will look for ways to avoid waste. So waste happens in healthcare when you use resources that are needless, typically either because they're inefficient and you know they're inefficient, but you're not sure how to improve that, or maybe you don't know the efficacy of those channels. So, one of the things we're certainly seeing, and I'm sure you're experiencing in your own organization, is that cost reduction is absolutely top of mind. The problem with cost reduction for its own sake is that oftentimes you can reduce costs at the expense of results. So looking for the lowest cost solution or constricting price for current products ultimately may have an impact where you're hurting your performance. So the waste that we like to pick on from a revenue cycle standpoint is printed and mailed statements, and that was the, I think, third most popular response on the polls. Nope, not quite ready to go to the next slide yet. Do you know how many printed communications are sent without action? Just really understanding the efficacy of what you're doing is really critical for understanding where you can eliminate waste. And with the situation in healthcare today where, unemployment is high, so your patients are struggling, more than ever to make those payments. Voluntary procedures are somewhat reduced. We're seeing that recover somewhat, but, certainly still a decline in revenues. There's really going to be a greater emphasis on reducing waste. So we predict that providers will look for opportunities to discontinue using inefficient communication channels in favor of those that are proven to drive results. So now we're ready for the next polling question. So the next one is really about, kind of piggybacking on that idea of reducing printed communications and looking at more efficient channels for engagement. The next question is a simpler one around digital communications. And just select one of these. Either we never or rarely capture email or mobile numbers from our patients for any reason. We send digital communications for medical only. Or we use more digital communications than printed statements for billing, and we'll let those responses come through. Okay, and that is absolutely the expected result, and certainly what we see when we talk to our customers and other providers in the marketplace, that certainly the digital information, and you can go ahead and go to the next slide. The digital information exists within your organization, but it's a challenge to figure out how to leverage that digital consent that you've got, maybe that you're using for clinical purposes, to other types of engagement like financial communications. So, certainly we see that there's a lot of benefit to digital engagement. One, it's more cost effective. You can actually send more digital communications to replace printed communications and still save money. And there's certainly a lot of benefit in terms of efficacy of digital communications. The other benefit of digital communications is that you can actually see the result. So when you print and mail a statement to a patient, you really don't know unless they make a payment if they've even opened that document. With digital communications, we can look at the data. We can see if they opened or clicked on the email. We can see if they responded to the text in real time. We can see if there's kind of multiple points of engagement through those digital channels. And we can really use that data and analytics to drive efficacy and carve out waste. So, clearly the time for digital engagement in healthcare financial communications is now. We've seen that patients want it. When we survey patients, overwhelmingly, they want either digital communications alone or some combination of digital and printed communications from their healthcare providers. It's less expensive. You can afford to do more with less, and it's more flexible. So our prediction is that billing and collections will become more efficient with greater reliance on digital platforms. We'll go to the next polling question. What data do you use today to tailor patient communications? So you know, a lot of these different tools exist today. I would think about how you're actually operationalizing them. So propensity to pay scoring, channel preference. Are you looking at patients' actual history? So do you know how they engaged historically, and do you use that insight to change communication strategies going forward with each individual patient? Are you looking at patient satisfaction or feedback surveys as a way to kind of feed in how you optimize your communications? Or doing anything with predictive analytics to determine more effective tactics? So we'll go ahead and move forward with the responses there. So interesting, patient satisfaction and feedback surveys. That's the highest I've seen that particular feedback, and that is a fantastic practice. So what better way to optimize your communications than to ask patients, right? What do you like? What don't you like? The problem is that patients don't always respond to surveys, right? So you're not necessarily canvassing all of your patient population, but that is a great way to move that feedback into your communications loop, and I'll let you go to the next prediction. So one of the things that we've seen is really using the propensity to pay data and to some extent channel data in new and innovative ways, particularly in the wake of COVID. One of the things that we saw is just because of the way propensity models work, that there was some lag. So there was a lack of real-time information available to providers in terms of understanding which patients were negatively impacted by COVID. So, you know, one of the observations we had when we ran the data is that 30% of patients that you would assume were high propensity to payers, so your propensity to pay models would be shown through whatever vendor, would show that they're high propensity to pay. They actually are in financial distress due to COVID. And the way we did that is we modeled certain characteristics of people who were likely to be impacted by COVID to provide that real-time insight. So, you know, that's an interesting data point. I think the other takeaway here is that you need to take those insights and really integrate them within your communication strategy. So how do you make sure that that data drives the experience so that you're connecting patients automatically or, you know, somewhat automagically with the engagement strategies that fit them, so you don't have to do that manually. So we predict that personalized patient communications will remain an important area of focus and even probably gain popularity as providers work to precisely match payment options to the needs of each patient, which is even going to be more critical given the dynamic nature of consumers and patients today. So we'll go on to the next polling question. This is great interaction. I appreciate the feedback. The next is, what was the biggest safety change you had to make for COVID? So here you pick one and only one, virtual call centers. So sending your work from home agents home, online patient check-in, virtual waiting rooms, telemedicine, contactless payments, and payment changes to protect PCI. So in this one, pick the one that was the biggest change you had to make as an organization, and we'll go to the responses. So telemedicine and virtual agents, work from home. Yep. So we definitely saw that amongst our providers, and that's not a surprising result. I am surprised that there were 3 that were not selected. Contactless patient payments, we're certainly seeing a lot of concern around making everything contactless, as well as virtual waiting room interest as we look to keep patients safe in the waiting room. So I'll let you go to the next slide for our prediction. And my prediction was that it would be difficult for people to pick the top, and maybe it was, but you know, we're certainly seeing that across the board. Technology is providing solutions to keep patients and your care providers and your office staff safe. You know, that's certainly the top of mind for everyone, and a challenge to think about while we're all have to continue to keep our organizations healthy as well. So, we've seen increased concern in all of the above. I think the observation here is, I'm sure you've looked at, as you look at strategies, is this a long-term or is this a short-term solution, right? So are the things that you're putting in place, is this going to be a 2020 initiative, or is this going to be something, investments and process changes that we live with for quite some time? So we found an interesting Harvard study about the likelihood that this will be, really top of mind for healthcare organizations through 2022. So our prediction is that all of these initiatives that were listed will not just be short-term, but lasting solutions for healthcare organizations. We'll go to the next poll. So the next one is, do you have the tools in place today to tackle the patient financial performance challenges that you're experiencing? So yes, no, or partially. So didn't get data on that one. So partially. I think that's typical. Certainly there are well-performing and low-performing channels. I'm pleased to see no as a low response. We did some research, if you go to the next slide, with healthcare revenue cycle leaders and saw a little bit different results. And that is that 63 don't believe they have the technology in place to resolve the healthcare financial revenue cycle issues that they have today. Our mantra and recommendation and prediction is that for those technologies that you have that aren't performing, that, really now is the time to hold vendors accountable. As you look for new technologies and new ways to solve new problems, or how to use old technologies to solve new problems, it's really, a challenge to navigate the vendor landscape and understand, which solutions are likely to resolve the challenges that you're experiencing. Case studies are a great way to hold your vendors accountable, so make sure that they're, living up to their promises with documented case studies about results that they've driven for other organizations similar to you. Performance data that they can point to, so metrics around the types of benefits they've been able to achieve. And our kind of key prediction is that guaranteed results from vendors will begin to find favor. So really vendors who are looking at ways to make sure that they hold themselves accountable, either through ongoing performance reviews or guaranteed results, as a way to make sure that we're delivering on the promises that we've made to you as providers. So we'll go to the next poll. How does the concept of artificial intelligence for patient engagement make you feel? I think, the observation is that automated intelligence technologies have gone farther on the clinical side of healthcare, but have really not taken hold as much on the financial side. So are you intrigued? Are you eager? Are you terrified? Or are you already using it today and getting fantastic results? So we'll go to the responses when you're ready. Intrigued. That's great. I love the stacked response here. More intrigued, fewer eager, very few terrified, and a few already using the technology. So that's, and with phenomenal results. So fantastic feedback, and we'll go to the next slide for our prediction. So we do believe that COVID will drive the need for more intelligent automation. So we've seen the benefits certainly on the clinical side of healthcare. We've seen the benefits in other industries. This is a stat from, I believe it's a McKinsey report, that talks about the fact that overall reduction in cost savings, so cost to serve, is reduced by 10% if you use artificial intelligence or really, smart analytics in order to drive engagement workflows. And that's a pretty compelling stat. So we had a stat earlier about print reduction, 30% print reduction. That's just one component of all the costs that you have that go into providing financial engagement in your revenue cycle. This is a 10% overall reduction in cost to serve. So as we look at ways to reduce cost, eliminate waste, really hone in on those high-performing channels and techniques, in order to scale that, in order to really get to a one-to-one level engagement, which is really what omnichannel communications is about, you really can't do that without an analytics-based automated solution. So we believe we will witness a virtual transformation fueled by artificial intelligence in healthcare. And we predict that AI-driven technologies will gain adoption as a predictable way to accelerate both optimization of your revenue cycle at a reduced cost. So again, we don't want to reduce costs at the expense of results, and AI will be an important way for us to make sure that we keep costs down while we continue to improve top-line performance. And patient experience. So we will go to poll number 8. So are there system silos holding you back? So as you think about how to streamline the patient experience, how you look to eliminate waste, how you look to optimize multiple communications, do you have a challenge with silos in your organization? Is it, and are you unable to move forward because IT doesn't have time? You're unable to consolidate the reporting. You are unable to get one single view of the patient. You have gaps in the patient experience, or all of the above, or none of the above. So what's holding you back from streamlining those operations? All of the above, yeah. So if we go to the next slide, you know, now is the time to think about integration, right? So as automated workflows become the norm, and the concept of a multi-vendor environment is, I think, and we, not to give away the next poll, but we will do a poll on multi-vendor environments. But the reality is you have different vendors, and even as vendors look to consolidate their capabilities, you're always going to have the need to integrate those systems. So another quote from McKinsey, and I'll just read it. Providers are advised to take stock of applications, interoperabilities of system engagement, electronic health records, revenue cycle processes, digital front doors, and supporting infrastructure, and then define an approach to move from COVID solutions to a sustainable, secure, and integrated virtual health platform. So other analysts are definitely predicting as well that integration is going to become critical as we look for ways to reduce costs, improve performance, and streamline the patient experience. So seamless integration with the EMR and the EHR are going to be critical, and really mission critical for leveraging the capabilities of those investments, right? So, one of your primary investments is certainly that platform, but then bolstering that with complementary capabilities and making sure that solutions that you select integrate seamlessly within that kind of core platform. And we predict that vendors will kind of quote unquote reach across the aisle and look for ways to work together to make this happen for you. So we talk to a lot of healthcare organizations that are looking to accomplish this. And, candidly, a lot of the times it's on the backs of the IT team. Our prediction is that vendors are going to have to look for ways to make this easier for you. And one example of benefits there, we see, one of the common challenges, to go back to an earlier slide, is that just that challenge of having digital information about your patients that you might be using on the clinical side, or even for appointment reminders pre-service, being able to leverage that information post-service. Pretty simple reason for that. It's in a couple different platforms. So when we find techniques to integrate that data, so to look at a patient profile from one kind of central point of view, one voice of the patient, we see healthcare organizations able to increase their digital engagement by a factor of 20. So really fantastic results when you can find ways to integrate those technologies. And again, look for your vendors to help you with that. So we will go to the next poll. What are the biggest changes you've implemented or intend to implement when looking for a new vendor? So again, things have changed in your landscape. We need to look for new ways to hold vendors accountable. The criteria you maybe need to select vendors has changed. So what are some of the things that you've implemented or you're thinking about implementing as you initiate RFPs? What are the new questions you're asking? Are you asking them about their ability to execute remotely now that most of the workforces have moved home? Are you looking for greater breadth of capabilities? Are you looking for accountability, guarantees, and other methods to make sure that vendors are holding themselves accountable to the results that they promise? Are you looking for digital experience, kind of those new innovators or the tried and true vendors, or proactive performance evaluation and vendor scorecards? So we'll go ahead and go to the results. Vendor scorecards, so really across the board kind of equal, I guess, feedback for all of these types of new strategies. So I guess the key takeaway here is that vendors are being held to a new standard, and that healthcare organizations are really on top of how they implement these changes and new accountabilities for their vendors in the process of searching for new solutions. So we'll go to the prediction slide. And our prediction, this one's fairly succinct, is that we'll look for hospitals to hold and other healthcare organizations to change the way that they're asking their vendors to be accountable. And certainly things like how many of your workforce are working from home? How do you expect that to change the experience that we have with you as a vendor? How are you thinking about ways to integrate with other solutions? Again, carrying some of that load themselves as opposed to, relying on you to do that integration work. We predict that all of those, new accountabilities will be placed on vendors in the coming years. So we'll go to the last polling question. If you could have a magic wand, what would your vendor environment look like for patient engagement? The same as it does today. It's perfect. We have the same vendors, but overall performance would improve. We'd have multiple vendors, but the underperformers would be replaced. And we're looking for consolidation, fewer vendors, and more seamless integration at a lower cost. And we'll go to the responses when they are ready. Okay, yeah. So we'll go to the next slide. Good for you, 5% who are completely satisfied with your solutions. That's fantastic. We certainly see consolidation as a theme, right? And again, we as vendors can do things to ease the burden of integration, but we definitely see a trend of providers looking to, do multiple things, more with less, provide more seamless platforms, provide one experience for the patient to make sure you're operating from that single point of view, that single data source. And the benefits are really threefold, actually fourfold. One, it's easier for you to manage, kind of to one platform, one vendor, or a minimal number of vendors. Certainly it's easier to tie that patient experience together because you're not integrating those separate technologies and processes. The advantage of that is the patient experience gets better. You're likely to drive cost optimization just through those integration of technologies. And ultimately, you have a clearer view of what your results are because, as we saw in the previous slide, that vendor dashboard, ongoing reviews to hold your vendors accountable, that's easier to do when they have more of a component of that overall solution. So, we've already seen this as a trend. We think it will continue. End-to-end solutions have, from our perspective, have kind of been a long time vision, but difficult to implement just because of different contract, expiration dates and some of those types of things. It's not easy to do, but we've certainly seen an increased interest in it from the providers we work with and have talked to. And so our prediction is that data consolidation and providing patients with a consistent, seamless experience and just the need to eliminate that waste and overlap in costs will continue to drive this trend. So I think we did pretty good. I think I should have given us a scorecard on, how close we were on our predictions. Maybe we'll send that as a follow-up, just a comparison of what the responses were to what our predictions are. So, as you can see in the data that we've gone through, we track this stuff, pretty closely because we want to make sure that we're understanding the challenges and opportunities that you're experiencing so that we can make sure that we're meeting the needs in the marketplace. So, I want to thank you for being interactive in this session and kind of playing along as we try something a little different with the format. So with that, I will turn it over to the Becker's team and we'll field any questions that we might have.
Yeah, thank you so much, Kristen, for the fantastic presentation. And we will now begin today's question and answer session. So please submit any questions you have by typing them into the Q&A box you see on your dashboard. And we'll try to get through as many questions as we have time for. And if we don't get to your question, Kristen will follow up after the webinar. We've already had several questions come through throughout the presentation, so we'll go ahead and jump in with those now. And so the first question that came through is, Kristen, you mentioned nearly 30% of high propensity payers are in financial distress. How do you determine who?
So what we did is, propensity to pay modeling is, common in healthcare. Obviously, there are multiple vendors that provide that capability, and we have one as well. But what we found with COVID is that because propensity to pay relies on, modeling over time, that there was a gap in currency of that data. So we looked at things like industry that the individual worked in, job titles, whether or not they were in a kind of a high or low propensity bucket previously, and a number of other factors, really just based on work environment and history, to determine whether or not they were likely to be in financial distress due to COVID. Now, we would caution that those are indicators, right? You can't precisely predict whether or not somebody is in financial distress, which is true of any predictive model, but you can certainly use those insights to potentially have a softer ask or train your call center teams or your patient access teams just to be aware of that sensitivity. So you might tread a little bit more lightly in terms of how you're asking patients for payment if you suspect that they might be impacted by COVID.
Thank you so much for breaking that down for us and walking us through it. The next question that we had come through, this person says, you talked about the importance of propensity to pay scoring. How does credit score information play into that?
Yeah. I guess similar to the financial distress question. So credit score models, I think, are fairly common in healthcare. We think that a different approach is warranted in healthcare that doesn't use a credit-based score, that doesn't do even a soft hit on the credit report. We see an aversion, with patients who see that there's been a credit hit when they're just, they just want to go to the doctor. They have something to resolve. So we think a little bit different model is warranted. Credit scores aren't always tremendously predictive of, you might, have one behavior in terms of how you pay your mortgage or how you pay for your car. But you might certainly have, different payment behaviors, particularly as it relates to unexpected healthcare costs. So, we really favor a non-credit-based approach that's really tuned for healthcare, that looks more at, kind of socio demographic characteristics, looks at historical payment behaviors, and some of those types of things to predict future payment behavior in healthcare. And then it's really about, I think, even more important than how you derive the score is how you operationalize that. So, we see a lot of predictive scoring in healthcare where, the product is the score. I think what we really need to think about is how to operationalize those scores. So rather than just, kind of providing that number to your staff, to use to drive, outbound calling campaigns and those types of things, or maybe be an indicator of, potentially offering financial assistance, you can actually incorporate that insight into the communications process through every touch point. So essentially offer what might be likely to be the best payment options for a patient, or really prioritize those that are most likely to be best. In other words, don't offer or don't recommend, a pay in full option to a low propensity patient with a high balance. You might want to start with a payment plan to get a better result quicker. It's really about not just the quality of the score, but how you operationalize that result and that insight.
Thank you so much. And I think that's just, perfectly answered that question, as far as it's really about looking at the other factors and then really, most importantly, how to operationalize those scores. So thanks for breaking down all those different factors for us and walking us through it. We're going to go ahead and jump in with one more audience question for today. And this audience member is wanting to know, with remote workers taking payments, how can I keep in PCI compliance?
That's a good question. I'm not sure we had that in the slides or not, because I don't know that it's maybe a well-known problem, but we certainly have seen that too, where you have remote workers that you've sent home to keep them safe. We've seen, I guess, different behaviors from providers. Some actually, are wanting to use automation in those cases. So allow your workers who are at home to handle more, kind of complicated patient calls, not payments. So certainly using IVR as a solution to automate, automate payments so that your agents don't have direct visibility into your card data, so you're not exposing that to them at home, has been one strategy. But then we've seen other providers who want to, really enable, they've actually turned automation off, right? So we've seen healthcare organizations that have been using IVR maybe use it maybe a little bit more sparingly, because they want to make sure that they're providing that one-to-one human interaction between their staff and patients. So in that scenario, when you have one of your staff members who are, taking card information over the phone, there have been some providers who have been concerned about the PCI risk, right? Your healthcare workers are sitting in their living room and they're typing in credit card information. So there's certainly risk to that. There are ways that you can combine both that human experience with technology. So one of the things that we've helped our healthcare customers do is to enable that human one-to-one interaction, but then use either a text link, a portal screen, or even a little kind of mini IVR application to collect the card information. So it takes all of that card capture out of PCI scope and takes it out of the visibility of the agent. So those are a couple of things that we've seen have been pretty effective with our customers, and they've chosen different, different providers have chosen different strategies just kind of based on their business environment.
Thank you so much, Kristen, for answering that question as well. Before we wrap things up today, I just wanted to check in to see if you had any final thoughts or anything else that you wanted to share with our audience today.
Yeah, no, just thank you for your time. This is a little bit different format, and I hope you enjoyed it. We certainly, again, appreciate the ability to hear from, it's just harder. We're not going to trade shows. We're not, there's just less of an opportunity to have a dialogue in the marketplace. So we thought this would be a fun format to be a little bit more interactive. So I appreciate the time. I hope you enjoyed it. And, if there's anything that you have questions about following the presentation, I'm sure we'll send out some follow-up materials, but please feel free to reach out after the session with any questions that you might have. We're always here to help.
Yeah, thank you so much, Kristen, it was a really informative and highly interactive presentation. We also want to thank RevSpring for sponsoring today's webinar. To everyone listening in today, please enjoy the rest of your day, and we look forward to having you join us for future webinars.
Thanks to the Becker's team, and thanks for everyone for joining.